Okay, so let's dive into something that might not be the most glamorous topic,
Yeah.
but it's actually surprisingly common, and it's super important, especially for women to understand, and that is pelvic masses.
Yeah.
Now, I know that term can sound kind of intimidating, but
Yeah.
these masses can range from totally benign cysts to, yep, even cancer.
Yeah.
So in this deep dive, we're going to break down exactly what a pelvic mass is,
Mm-hmm.
how it's diagnosed, and what the treatment options are.
That sounds great. I think it's amazing how much anxiety can just come from not knowing what's going on.
Oh, for sure. Right.
Yeah.
And knowledge is power,
Exactly.
they say.
Yeah.
So first things first, what exactly is a pelvic mass?
So think of your pelvic area like a bustling city center.
Okay.
You got your intestines, your bladder, and of course for women, the reproductive organs.
Mm-hmm.
Ovaries, fallopian tubes, uterus, cervix, all vital players in this complex ecosystem.
Yeah.
And a pelvic mass is essentially any abnormal growth that pops up in this area.
Okay. That makes sense. It's like a rogue construction project in our pelvic city.
Exactly, yeah.
And just how common are these pelvic masses?
Well, you might be surprised to hear that they're actually quite common,
Okay.
especially during a woman's reproductive years. It's not something to necessarily panic about,
Right.
but it is something to be aware of.
And here's where it gets really interesting because the types of pelvic masses can actually vary depending on a woman's age and whether she is premenopausal, postmenopausal, or pregnant.
Right.
Now, for this deep dive, we're specifically focusing on non-pregnant women.
Good point.
Yeah. Now, I'm sure many of you are wondering, how do I know if I even have a pelvic mass?
Yeah.
It's not like you can just peek down there and take a head count.
Yeah, not quite.
Right.
What's interesting is that some pelvic masses actually don't cause any symptoms at all.
Really?
They're like stealthy ninjas hiding out in the pelvic city doing their own thing.
Sneaky little things. But if they do cause symptoms, what should we be on the lookout for?
Well, pain is often the first clue. Yep. It can be, a dull ache. It could be a sharp stabbing sensation, something that comes and goes, or a constant companion. And if a mass ruptures or causes something called adnexal torsion,
Okay.
you can picture one of your ovaries doing a twist. The pain can be really sudden and incredibly intense.
Oh, that sounds like a trip to the ER in the making.
Definitely. To use kind of a more relatable analogy, imagine like a water balloon inside your abdomen.
Okay.
If it twists, cutting off its blood supply, or if it bursts, the pain would be pretty unmistakable.
Right.
Yeah.
Okay, that paints a vivid picture.
Yeah.
So sudden severe pain is a red flag.
Mm-hmm.
What about other symptoms?
Well, keep an eye out for any changes in your menstrual cycle. Things like unusually heavy bleeding or spotting between periods. Or even a missed period could be signs of a pelvic mass,
Okay.
throwing things off balance. And some women experience pain during intercourse. Basically, any unusual discomfort or change in your pelvic region warrants a trip to the doctor.
So it's kind of like that check engine light in your car, right?
Yeah.
If it comes on, you don't ignore it. You get it checked out.
Exactly. And early detection is key when it comes to pelvic masses.
Right.
The sooner you catch it, the sooner you can get peace of mind or, if necessary, the appropriate treatment.
Speaking of detection, let's walk through how these pelvic masses are actually diagnosed.
Sure.
What's the first step?
Well, it usually starts with a good old-fashioned pelvic exam. This allows your doctor to physically check, both your internal and external anatomy, feeling for any abnormalities.
Makes sense.
Huh.
But I imagine they need a bit more than just a good feel to really get the full picture, right?
You're right. Imaging technology plays a really crucial role here. Ultrasound is often the go-to tool as it allows doctors to, see those internal structures without any invasive procedures. It's like getting a sneak peek into your pelvic city with like a high-tech camera.
I love that analogy.
Yeah.
So ultrasound is like the city planner's map. But what if they spot something suspicious during the exam, like, say, a growth on the cervix?
Good question. In that case, they might recommend a biopsy.
Okay.
And this involves taking a small tissue sample, and then they examine it under a microscope to check for any cancerous cells.
So that brings us to the big C word that I think is probably on everybody's mind. Just how likely is it that a pelvic mass turns out to be cancerous?
Well, here's the good news. Most pelvic masses are actually benign,
Okay.
meaning they're not cancerous. But
there's always a but.
there is. The risk of cancer does increase with age, especially after menopause. And that's why, regular checkups and screenings become even more important as we get older.
So it seems like the key takeaway here is early detection is everything. The sooner you get checked out, the sooner you can breathe easy. Or, if needed, get the proper treatment.
Couldn't have said it better myself. Early detection can make a world of difference.
All right, so let's say a woman does have a pelvic mass. What happens next? What are the treatment options?
Well, that's where things get a bit more nuanced because the treatment really depends on several factors. How severe are the symptoms?
Okay. What type of mass is it?
Mhm.
Is it cancerous or benign? All these things come into play when deciding on the best course of action.
So there's no one-size-fits-all approach.
Exactly. And in some cases, if the mass is small and not causing any trouble, the doctor might just, opt to monitor it over time.
Okay.
Think of it like keeping a watchful eye on that road construction project in your pelvic city.
Watchful waiting. Got it. What about for the masses that are causing, more noticeable symptoms?
Well, sometimes medication can help manage those symptoms.
Okay.
For example, if a woman is experiencing, heavy bleeding due to a fibroid, medication can help kind of regulate her cycle and reduce the flow.
So sometimes it's a matter of managing the symptoms rather than eliminating the mass itself.
That's right. And in other cases, particularly for, larger masses or those causing more severe symptoms, there are minimally invasive procedures like uterine fibroid embolization.
Hold on, let's unpack that one. What exactly is uterine fibroid embolization? Sounds a bit intimidating. It's actually a pretty remarkable procedure. Imagine like a tiny team of specialists navigating through your blood vessels, like a miniature SWAT team on a mission.
Okay.
They reach the fibroid and they cut off its blood supply, causing it to shrink.
Wow. That's incredible. So it's like a targeted operation within your pelvic city without like any major construction or demolition.
Precisely.
Wow.
It's a testament to how far medical technology has advanced. But of course, there are still cases where, traditional surgery might be the best option,
Right.
particularly for cancerous masses or those that are causing severe pain or complications.
So surgery is like the last resort when all other options have been exhausted.
Exactly. And even then, surgical techniques have, evolved significantly,
Right.
becoming less invasive and more precise, allowing for, faster recovery times and fewer complications.
So it seems like there's a whole spectrum of treatment options,
Mhm.
from watchful waiting to minimally invasive procedures, and in some cases, surgery.
That's right. It's important to remember that you have options.
Yeah.
And a good doctor will work with you to determine, the best course of treatment based on your individual needs and circumstances.
This has been incredibly insightful so far. We've covered a lot of ground, from defining what a pelvic mass is to the various diagnostic tools and treatment options available.
And we've only just scratched the surface. There's so much more to explore when it comes to pelvic masses.
Let's delve even deeper into this fascinating topic, with a focus on the specific types of pelvic masses and how they manifest in different ways. Stay tuned.
Welcome back to our deep dive into the world of pelvic masses.
All right, so before we took a little pause, we're talking about that whole spectrum of treatment options, from like watchful waiting to minimally invasive procedures and even surgery in some cases.
Exactly. It's all about finding the right approach for each individual situation.
And I think it's time to delve a little deeper into the different types of pelvic masses that women might encounter.
Yeah.
We've mentioned fibroids and cysts, but let's unpack those a bit more.
Absolutely. Uterine fibroids, for instance, are incredibly common. They're non-cancerous growths that develop in the muscular wall of the uterus.
Okay.
Imagine them like little knots in the fabric of your uterus, sometimes just tiny pebbles, other times growing as large as a grapefruit.
Whoa, a grapefruit. That's a pretty substantial knot.
Right.
No wonder they can cause problems.
Right. And the symptoms they cause can vary widely, too. Some women with fibroids experience no symptoms at all, while others might have heavy menstrual bleeding pain during intercourse, or even a feeling of pressure or fullness in their lower abdomen.
So it's a bit of a mixed bag with fibroids. Sometimes they're silent passengers, other times they're causing quite a ruckus.
Yeah.
What about those ovarian cysts we mentioned earlier?
Ovarian cysts are another frequent visitor to the pelvic city.
Okay.
They're fluid-filled sacs that develop on or in an ovary.
Mm-hmm.
And here's the thing, most of them are actually functional cysts, meaning they're a normal part of the menstrual cycle and tend to resolve on their own within a few months.
So they're like temporary pop-up shops in our pelvic city, here today, gone tomorrow.
Exactly.
Okay.
But sometimes cysts can grow large, cause pain, or even rupture, which can be quite a painful experience.
That sounds like a scenario where watchful waiting is probably not the best strategy.
You're right. If a cyst is causing symptoms or doesn't seem to be resolving on its own, a doctor might recommend medication or even a procedure to remove it.
So with both fibroids and cysts, it's all about monitoring the situation and intervening if necessary. What about other types of pelvic masses? Are there any that are more concerning than others?
Well, there are certain types of masses that warrant closer attention. For instance, endometriosis is a condition where tissue, similar to the lining of the uterus, grows outside the uterus. These endometrial implants can form masses and cause pain, irregular bleeding, and even infertility.
Endometriosis, that's one I've heard a lot about, but
Yeah.
honestly, I'm still not quite sure I understand what it is. Like the lining of the uterus decides to go rogue and set up camp in other parts of the pelvis, right?
Yeah. That's a great way to put it. It's like those endometrial cells have a serious case of wanderlust, and unfortunately, these misplaced cells can cause a lot of trouble.
So it's not just about the masses themselves, but also about the underlying conditions that might be causing them.
Exactly. And that's why a thorough evaluation by a doctor is so important. They can determine the type of mass, uh, assess the severity of the situation, and recommend the most appropriate course of action.
Okay, we've talked about fibroids, cysts, and endometriosis. Are there any other key players in the pelvic mass game that we should be aware of?
Well, there are less common types of masses that can arise from the fallopian tubes, the cervix, or even the pelvic bones. And of course, there's always the possibility of a cancerous tumor developing in any of these areas.
That brings us back to the importance of early detection. It's like with any city, the sooner you identify a potential problem, the better equipped you are to address it.
Couldn't agree more. And that's why regular checkups and screenings are so crucial. It's about being proactive with our health rather than waiting for a major crisis to hit.
Speaking of being proactive, I think it's time we shift gears a bit and talk about what women can do to advocate for their own pelvic health. What are some practical steps they can take?
That's a great question, first and foremost. I'd say get to know your body, pay attention to any changes or unusual symptoms. It's about tuning in to those subtle signals our bodies are sending us.
It's like becoming the mayor of your own pelvic city, right? You need to be aware of what's happening in your domain.
Exactly. And part of being a good mayor is knowing when to call in. The experts don't hesitate to reach out to your doctor if you're experiencing any concerning symptoms or simply have questions about your pelvic health.
So open communication with your doctor is key. What else can women do to stay on top of their pelvic health?
Regular checkups and screenings are essential, as we've discussed. It's about establishing a good relationship with your gynecologist and making those appointments a priority.
It's like scheduling regular city council meetings to make sure everything is running smoothly in your pelvic city.
I love that analogy. And beyond the medical aspect, there are lifestyle factors that can play a role in pelvic health as well.
Oh, I'm intrigued. Tell me more about these lifestyle factors. What can women do to support their pelvic well-being from a holistic perspective?
Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity can all contribute to a healthy pelvic region, and managing stress is crucial too, as stress can wreak havoc on our hormonal balance.
So it's about taking care of the entire city, not just focusing on one particular neighborhood.
Exactly. And remember, knowledge is power. The more we understand about our bodies, the better equipped we are to advocate for our own health and well-being.
This has been such an eye-opening conversation. We've explored the different types of pelvic masses, the importance of early detection, and the wide range of treatment options available.
And we've even touched on the lifestyle factors that can contribute to a healthy pelvic city.
But before we wrap up our deep dive, I think it's important to address the emotional side of things. Dealing with a pelvic mass, whether it's benign or cancerous, can be a very stressful and anxiety-provoking experience.
You're absolutely right. It's not just about the physical symptoms, but also about the emotional toll it can take.
And we're back for the final part of our pelvic mass deep dive.
Yeah?
I gotta say, I feel like I've learned so much already.
Oh, yeah, me too. It's been quite the journey, you know?
Wow.
Through the pelvic city, we've explored those intricate neighborhoods, met some of its common residents,
Yeah.
even discussed how to keep things running smoothly.
Right. And now I think it's time we empower our listeners to become like the best possible mayors of their own pelvic cities.
Ooh, I love that. Okay, so what advice would you give to someone who's feeling, a little overwhelmed, maybe even a bit scared after learning all this?
I think first and foremost, remember that knowledge really is power.
Yeah.
The more you understand about your pelvic health, the better equipped you'll be to make informed decisions
Yeah.
and advocate for yourself.
Yeah, that's so important. I mean, it's easy to just feel helpless. right?
Absolutely.
When you're faced with a health concern. But taking the time to, really educate yourself can be incredibly empowering.
It's like having a detailed map of your pelvic city
Yeah.
and knowing exactly where all the resources are.
Absolutely. Speaking of resources, let's talk about some concrete steps that listeners can take to be more proactive about their pelvic health.
Okay, so step one, as we've mentioned already several times, is to schedule those regular checkups and pelvic exams.
Absolutely. I mean, think of these appointments like routine maintenance checks, right, for your pelvic city.
Right.
Just making sure that everything is functioning as it should be. And don't be afraid to ask your doctor any questions that you might have.
Yeah, no question is too silly or embarrassing when it comes to your health.
Exactly. Your doctor is there to guide you and provide you with the information that you need to make informed decisions about your body.
And remember, it's not just about going to the doctor. It's about being like an active participant in your healthcare journey.
Yes, I love that. It's about shifting from that passive patient role to a more empowered and proactive approach.
Speaking of being proactive, let's touch on the importance of self-advocacy. What does that actually look like in the context of pelvic health?
It means speaking up for yourself, asking questions, doing your research, and seeking second opinions if needed. It's about really truly feeling confident in your ability to make decisions about your own body and your healthcare.
It's like stepping into the role of like a true leader in your pelvic city,
Yeah.
advocating for its well-being and making sure that its needs are being met.
That's such a great way to visualize it. And remember, advocating for yourself doesn't necessarily have to mean doing it alone. There are a ton of resources out there
Sure.
available to support you, like online communities and support groups to patient advocacy organizations and, healthcare professionals specializing in women's health.
It's like having this whole team of advisors and experts at your disposal, ready to guide you and support you every step of the way.
Exactly. And I think don't underestimate the power of sharing your experience with others. Talking to friends, family members, even joining like online communities can provide such a sense of connection and validation. It just reminds you that you're not alone on this journey.
Yeah, it's like hosting a town hall meeting,
Yeah.
In your pelvic city,
Yes.
sharing stories and experiences and learning from each other.
I love that. It's about creating the sense of community and support around a topic that honestly is often shrouded in silence and stigma.
Okay, before we officially wrap up this deep dive, I want to leave our listeners with one final thought.
Okay, I'm all ears.
So throughout this conversation, we've used that analogy of like the pelvic city to kind of illustrate the complexities of this region. And while we've focused a lot on the potential challenges, things like pelvic masses, it's important to remember that the pelvic region is also a source of incredible strength and power.
Oh, that's such a beautiful perspective. It's about like recognizing the resilience and beauty of our bodies, even when we're faced with, difficulties.
Exactly. The pelvic region is the seat of creation, the source of life, and a place of, deep connection and pleasure.
Yeah, it's just this reminder that even amidst the challenges, there's so much to celebrate and cherish about our bodies.
Absolutely. Well said. And on that note, we have reached the end of our deep dive into the world of pelvic masses. We really hope that this conversation has empowered you with knowledge, inspired you to be more proactive about your health, and reminded you that you are not alone on this journey.
It's been an absolute pleasure exploring this topic with you and all of our listeners out there. Just remember, stay curious, stay informed, and most importantly, stay connected to your body and your own inner wisdom.
I love that. Until next time, dear listeners, keep diving deep and keep those pelvic